and important tasks that need to be done. And it's sort of ironic that
So welcome and good morning. I do want to thank everybody for getting up early and getting here. I also want to thank The Hill. They've been just a tremendous partner, our media partner, The Hill, and Christy's here this morning. Christy, if you want to wave. Wonderful to work with. Really appreciate everything that they've done for us. And there are copies of The Hill. If you haven't picked up a copy, please feel free to do so. And it is now my pleasure to turn the program over to Gwen Tolbart.
Thank you, Robin, and hello, everybody. You know, when I thought about disruptive women, I kind of went back to my childhood a little bit, because I come from a family where there's more women than men, not counting the 3 husbands that my grandmother had. And from that came 8 aunts who were comforting, loving, coddling, taught me a lot, and spoiled me a lot because I was the only one of all my cousins that was an only child. And then there was Auntie Kay. But you know what? There was a method to Kay's madness, and there's a method to the madness of this group because it's all positive, and I know that. And I'm very proud to be here today, and I welcome all of you. Childhood obesity, a big, fat national challenge. We're going to introduce you now to the panel that we have, wonderful people here who are going to contribute to today's success and who are going to really enlighten you on a lot in terms of this particular subject and the importance of it.
Good to be with you. Thank you. I actually had the option of going to another meeting this morning. It was called Boring Men Who Pontificate. I passed that up. It was a tough call. There are some people that think that childhood obesity is not a key issue, and that it's not important, and that it's not the federal government's role to be involved with that. I don't know how to describe these people to you, or how they might, you know, be thought of in terms of this policy debate. Children who live in food insecure households, and I'll explain what that means, are sick more frequently, miss school more often, and do more poorly in school. They are more susceptible to cognitive impairment and likely to engage in antisocial behaviors. Hospitalization of obese children and youth ages 2 through 19 has doubled between 1999 and 2005. The childhood obesity rates have tripled since 1980, and the current data says 1/3 of children over the age of 2, 1/3 of 2-year-olds or above are obese.
We're going to bring you down to the community level right now with this. And we're going to bring it right to your own neighborhoods with Aimee and Diana.
I have spent more than 20 years of my life working in the healthcare industry, more on the other end, the book end, which Don was talking about, which is with people like us, and dealing with things like hypertension and high cholesterol and diabetes and joint pain and depression and asthma and all of the things that these children are going to face if these issues become habits. And I have which might explain part of the reason why Aimee and I came in from Philadelphia, an 11-year-old and a 12-year-old boy. And as you know, in adolescence, they kind of call them like they see them. So my son says to me, you know, Mom, we should be able to go to McDonald's and we should be able to eat this sugar-coated cereal because it takes 21 days to form a habit. And if I just eat it every once in a while, I'm not going to have a problem. At which point I put him in the YMCA after-school program. Building social value, and whether it's on the individual level or the family level or the country level, is really making people feel like, you know, they are capable and they are competent and they can be healthy and they can make these changes. And where they live, work, and play, they will have a better experience for having done so. And so, you know, as that child is moving throughout its day, the ability for all of us, you know, whether it's on, you know, a public and a private sector, or whether it's a team within a pediatric practice, or whether it's my home and my school and my YMCA after school program, being able to work together so that we are able to get that momentum to kind of address this big fat national challenge.
But on a national level, the YMCA has embarked on what we call Activate America. And we started this journey about 5 or 6 years ago. And the YMCA is now starting to realize that, you know, this obesity, healthcare, it's really everybody's issue. No one organization can do this alone. Within Philadelphia, we're recently named a Pioneering Healthier Communities YMCA. We're one of 140 communities to take on this it's pretty much a challenge. And our main focus is obesity and well-being of children within the city of Philadelphia.
Great to be in a room filled with other women and men who love shaking things up, because I am here to tell you that with this issue, we do not need a paradigm shift. We need a tsunami. We need an earthquake. We need to really shake it up, literally, physically, metaphorically, in every single way. So this is a great group to get it moving and started with. So thank you for having me come and talk to you. No news flash, right, Gwen? The statistics are in, and guess what? We're fat. Fat. Not the P-H-A-T that is cool in school. We are fat, F-A-T. So the good news is there are solutions on the horizon. We are going to get moving. I love it that Michelle Obama picked that as her slogan, because that's really what it's all about. We've got to get moving.
Got to move, or lose your groove. Get up now and move with me and see how much fun one person, come on, we can play ball, you can dance or run. There's no limit to the fun. You got to move or you lose your groove.
So, last thought. Creating this shift. Lifestyle earthquake. It's not a paradigm shift. It's a lifestyle earthquake. We need to shake our very foundations in order to shake theirs. We've just got to do what the DreamDog kids are saying. We've just got to get up and move, or you lose your groove. Thank you.
As disruptive women, attack it, take it on, and make our children fit, happy, and healthy. Thank you so much.